Welcome to LexCura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of LexCura Summit. Missed visits in home health are among the clearest and most actionable forms of negligence to identify in the record. The plan of care establishes how often services were ordered. The visit logs show what care was actually delivered. When those two do not match, the gap may establish the breach. The analysis becomes even more important when the patient deteriorates during that period through a fall, wound progression, medication complication, infection, or rehospitalization. In this episode, I will explain how to read the plan of care, visit logs, scheduling records, and communication notes together to identify missed care, establish what the agency knew, and connect the gap in services to the patient's resulting harm. Okay, so here's something to think about. In home healthcare, a single missed visit isn't just a scheduling issue. It can actually be the first domino in a chain of events that leads to serious harm for a patient.
That's such a striking way to put it. I think most people, even attorneys, might not realize just how much weight a missed visit carries. It sounds so minor on the surface, but there's clearly a lot more going on here.
Absolutely. And it all comes down to the plan of care. This isn't just a guideline or a suggestion. It's a physician-ordered document that specifies exactly what care a patient needs, how often they need it, and why. When an agency doesn't follow through on that, it's not just a logistical failure. It's a breach of the standard of care.
And that breach can have real tangible consequences, right? Like, if a patient is supposed to have skilled nursing visits 5 times a week, but only gets 2, those 3 missing visits aren't just numbers on a chart. They represent 3 missed opportunities to catch a problem or prevent a complication.
Exactly. And that's where the ripple effect comes in. Let's say a nurse was supposed to assess a wound on Tuesday, but the visit didn't happen. By the time someone checks on Friday, the wound is infected. That infection didn't happen in spite of the missed visit. It happened because of it.
And what's fascinating is how often these cases are undervalued. I mean, if you just say, this agency missed 3 visits, it's easy to dismiss it as a minor issue. But when you frame it as, this agency left a medically complex patient without the monitoring their doctor said they needed, and that led to harm, it's a completely different conversation.
That's exactly the shift attorneys need to make. This isn't a paperwork issue. It's a patient safety issue. And the key to making that argument is the causation bridge. You have to connect the dots between the missed visits and the harm that occurred.
So how do you go about building that bridge? It seems like it would require a lot of digging into the records and piecing together a timeline.
It does, but when you do it right, it's incredibly compelling. You start with the plan of care to establish what was supposed to happen. Then you look at the visit log to see what actually happened, or didn't happen. From there, you analyze the clinical records to identify signs of deterioration that should have been caught during the missed visits.
And then you tie it all together by showing how the absence of care during those gaps directly contributed to the patient's deterioration. It's a meticulous process, but it sounds like it's absolutely necessary to make the case.
It is, and what's interesting is how much of this hinges on documentation, or the lack of it. The visit log, for example, is such a critical piece of evidence. It's not something attorneys always think to request, but it's the document that shows what was supposed to happen versus what actually happened.
And it's separate from the nursing notes, right? Those only document what occurred during the visits that did happen. The visit log is where you see the gaps, the missed visits that weren't rescheduled or documented.
Exactly. And if there's no physician notification or updated plan of care to justify those gaps, that's your breach right there. But it doesn't stop there. You also have to consider the regulatory framework.
Oh, that's a great point. CMS regulations require home health agencies to follow the physician's plan of care, notify the physician if they can't provide services, and document everything. These aren't optional compliance items, they're federal requirements.
And that's why the regulatory layer is so important. It takes the argument out of the realm of clinical opinion and anchors it in objective standards. You're not just debating what a reasonable nurse would have done. You're pointing to specific requirements the agency failed to meet.
And it also opens up discovery opportunities, doesn't it? If you can show that the agency has a pattern of failing to document missed visits or notify physicians, that's a systemic issue. It's not just one-off negligence, it's institutional noncompliance.
Exactly. And that can support a punitive damages claim in some cases. But even beyond that, it's about looking at the visit log holistically. One missed visit might be defensible, but a pattern of missed visits across multiple weeks with no documentation or notification, that's a different story.
And then there are the other records that can add layers to the case, like phone logs, for example. If a patient or family member called the agency during a gap period and didn't get an adequate response, that's another breach point.
Or scheduling records. Those can show whether the missed visits were due to staffing issues or operational failures. And then there's the physician communication log. If the physician wasn't notified about missed visits, that's a direct regulatory violation.
It's like peeling back layers of an onion. The more you dig, the clearer the picture becomes. The clearer the picture, the stronger the case.
And that's why building the causation bridge is so important. It's not enough to show that visits were missed. You have to show how those missed visits led to harm. What was the patient's condition at the time? What risks did the physician identify when they ordered the visits? What signs of deterioration were visible in the records that did exist?
And most importantly, what would have happened if the nurse had been there as scheduled? It's a meticulous process, but when you can lay it out step by step, it's incredibly compelling.
And that's the key takeaway for attorneys. This isn't a paperwork case, it's a patient safety case. And when you frame it that way, it's much harder for the defense to argue that it's just an administrative issue.
Exactly. And it's a reminder of how important it is to request the right records and analyze them thoroughly. The visit log, the plan of care, the contact logs, the scheduling records, all of these pieces fit together to tell the story of what happened, or what didn't happen, and why it matters.
It's also a reminder of the broader implications. These aren't just isolated incidents. They reflect systemic issues in how some agencies operate. And when those issues lead to harm, they need to be addressed, not just for the sake of litigation, but for the sake of patient care.
Well said. Missed visit cases might seem undervalued at first glance, but when you dig deeper, they're among the clearest liability cases in home health. It's all about reframing the narrative and building a strong evidence-based argument.
And that's the challenge and the opportunity for attorneys to take what might seem like a small detail and show how it has big consequences. Because at the end of the day, this isn't just about missed visits. It's about the patients who were left without the care they needed and the harm that resulted.
Couldn't agree more. And with the right approach, these cases can make a real difference, not just in the courtroom, but in how agencies deliver care moving forward.
Exactly, and that's a goal worth pursuing. Thank you for listening to LexCura Clinical Insights. A missed visit case is not established by showing only that a visit did not occur. The full analysis must determine what care was ordered, why the visit was missed, whether the physician or patient was notified, whether the visit was rescheduled, what monitoring or treatment was lost, and what happened clinically during the gap. When the plan of care, visit record, communication notes, and patient timeline are aligned, the chart may show a direct progression from ordered care to missed service to unrecognized deterioration and ultimately to injury. That connection is what transforms a scheduling failure into a supported negligence and causation argument. For more clinical intelligence, litigation analysis, and practical guidance, visit LexCura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of LexCura Clinical Insights.